Welcome back, and thank you for staying with KTN Prime. Of course, we start that conversation that I just earlier hinted of, all to do with health. Where exactly are we, especially after the donor freeze in funds? And joining me for this particular conversation is Dr. Sultani Matendechero, Deputy Director General for Health at the Ministry of Health, specifically the State Department for Public Health and Professional Standards. Good evening, Dr. and thank you so much for making time. So straight to it. Okay, karibu sana. Straight to it. Let's talk about the freeze in aid. What is the extent of the impact?
Yeah, so maybe let me just start by saying that we are currently going through the process of being able to identify the full impact of the move by the US president to now pull out, especially of WHO, and then also to put a bit of a freeze on some of the bilateral funding arrangements that we've had with the US. And one of the things that I would like to say is that this was expected. It's just that, you know, we've never really thought that it would be done in such a rush way, but then it was expected. Remember, Donald Trump was there for one term, then he left. By the time he left, he had already started showing signs of moving towards a more conservative approach to funding of health programs. So we are now looking at the extent, and what I would just like to say is that there has been a lot of panic, but from the outset, we are able to say that it is something that we will be able to reorganize ourselves and to take care of, especially when it comes to the various stakeholders. I think it is not necessary for the general public, who are the recipients of the public health services, to be extremely worried. Actually, for me, I am really worried. Actually, it's been very difficult because we really have to come up with the innovations, mechanisms. How do we make sure that public health services are not interrupted, so that even with the pullout, we are able to maintain at least the very minimum services that we need to have. You
say this was expected, going by, you know, President Donald Trump's first term. So then if we anticipated it, did we have a guideline, a strategy, perhaps, so when it happens, we know we revert to something?
So I think, unfortunately, sometimes, and this is something that happens quite a bit, you know, we also have to look at our environment. We are categorized as countries that are in the global south, which means that by extension, we are experiencing a little bit of a strain economically. So you'll find that the little resources we have are really spread out thin. So there are so many things that we need to do, and the resources are less. So often we find ourselves in a situation where if we are being supported, like, for example, in the health sector, we will tend to focus on other sectors because we are anticipating that the support will keep on coming. So even, and it has happened in the past, we are told, okay, you need to quickly start looking at how you can take over some of these functions and fund them yourselves. But then, in the fullness of time, it doesn't happen. So, whereas we were anticipating this, we didn't think that it was going to be so drastic. And that's why we are now really working around the clock within this very short period of time to be able to now align, because now it has happened, it is here with us, and it is our duty to now make sure that there is continuity of service.
Before we even get to the nitty-gritties, I know officers from the Ministry of Health, yesterday they were supposed to meet the acting U.S. ambassador to try see if there's a way they can persuade. Did it bear any fruit?
So what, you know, of course, in such circumstances, there are quite a number of interventions that you undertake. There is nothing like just saying that there is one golden intervention that is going to solve everything. So there are quite a number of interventions that we have been able to identify, potential interventions, which we will be implementing together. You know, a comprehensive package of interventions. One of them is a diplomatic intervention to reach out to the US and see how we can be able to mitigate some of that, the impact of that pullout.
Yeah.
Maybe even with the, with the anticipation that probably maybe some of the intended actions can be reversed, So it is a discussion that will go on. It is a discussion that we intend to have at national level, at the state level, at international level, regional. It is something that even WHO has reached out.
Yeah. They
have appealed to the president of the US and said, reconsider the pulling out of WHO. So there's that diplomatic channel that we have to look at. And diplomatic interventions do not just take one day. They take time. We expect that maybe there will be rearrangement in the funding arrangements, so that maybe the US, being a conservative government now, will be looking at funding arrangements that maybe look at a give and take kind of environment. So that instead of just saying, we are the ones who are giving you and you are just benefiting, how do we make it so that whereas we support you, we also benefit? So there is a return. It is like an investment. So probably those are now the areas that we want to really look at, and we see how do we go into it in a manner that is going to ensure that we do not disrupt delivery of health services.
Okay, so even as the country looks to diplomacy, which so many people have said that the move by US is actually illegal, there are those that argue perhaps it should be an eye-opener to us as a country. It's high time that we stop depending on donors to facilitate our health and fund our health. So let's talk about that, because you've mentioned the fact that we are reorganizing ourselves. I heard that the CS for Treasury, that is Mbadi, said that development budget will be slashed. But this is a 30.9 billion funding, gap. It's not something small. Even if we reorganize ourselves, are we likely to get even close?
No, we can't. We cannot get 30 billion shillings from Exchequer.
Yeah.
Sitting there, how? It is not possible. But one of the things that I can tell you is that, and I keep on remembering something that is always said that, every dark cloud has its silver lining and things like that. I'll tell you two things. In the discussions that we've had, because we've really been crunching the numbers, looking at things, looking at them, and really reorienting. There are some discoveries that we are making that are very interesting.
Okay.
I'll give you just two examples because of time. But there is a program we have that is called Neglected Tropical Diseases Program. These are the worms, the bilharzias, trachoma, snake bites, and so on. This is a program that heavily depends on external funding, Almost 100% depend on external funding.
Yeah.
Now, one of the interventions that we carry out is deworming of school children. And at one point, we were receiving donations of about 10 million tablets of albendazole to be used in deworming. The value of these tablets, because we were getting the original albendazole tablets, which are called Zentel. If you go to the chemist now, you can ask the price of Zentel. It is anywhere around 180, 200 shillings per tablet.
Yeah.
So the value of that donation was coming to about 2 billion Kenya shillings. Because at 200 shillings per tablet, 10 million tablets is about 2 billion. So if we are going to look at it in terms of saying that now this donation has been stopped, we will say that we are losing resources worth 2 billion. But the same tablet, we can manufacture it here in Cosmos at 1 shilling per tablet. So if you translate it to how much we are losing, then if we are looking at it in terms of how much it will cost us to manufacture, then it comes to 10 million shillings.
Which is less.
Yeah. So what is the difference? 1.99 billion. We are worried that we are losing 2 billion, when in actual sense, we can translate it to 10 million. So there is a very big opportunity for us to be able to just look at it and see where are the touch points that we can be able to take advantage of, so that this figure of 30 billion, we might actually bring it down to a manageable figure. Number two, the second example was, you look at something like nutrition, I'm really surprised that we are losing up to about 374 billion shillings every year to nutrition because of inaction, you know? And yet, we are saying that every year we need about 5 billion to go into nutritional interventions. About 3 billion is coming in from the US, and another 2 billion from other sources, including our own sources. Now, if we say that we look at this as an investment, yeah, so that we say, let us put in this 5 billion that we require as an investment. And then we follow through so that in the fullness of time, you know, downstream, we can be able to start realizing part of these losses that we are making.
Yeah.
So it can be an investment that we are making into the health sector. And I just want to tie it to what you said when the CS for the Treasury, for the National Treasury, said that we are going to cut down on development budget so that we can be able to plug some gaps in terms of recurrent budget. We keep on looking at health as a recurrent expense. But the truth is that health can be one of the most lucrative investments that countries can make. Actually, we could be failing or losing on opportunities for development because of not investing adequately into health. So depending on how we look at it, especially at this time when we are faced with this crisis, we might just find that this is our opportunity to unlock the potential that is there in investing in health, so that we can now be able to get the kind of development that we need.
But someone might ask, so then what is the turnaround time for this? Let's say we get into it. How long will it take before we actually fully implement it?
Absolutely very important, because now we have to look at it in terms of, you know, sometimes we really have to be patient. And that's what the developed countries have done, you know. They have looked at very strategic investments. How do we invest in healthcare so that 5, 10, 20 years down the line, we can now be able to recoup on what we are putting in. Now, we should not just look at it in terms of what they are now enjoying now, you see? Because probably they put in the investment 20 years ago.
Yeah.
So we also have to be patient and look at it and be able to see what is it that if we put in our investment now, we can now be able to reap in the short term. What is it that we can be able to achieve in the medium term? What is it that we are looking at in the long term?
Yeah.
So it is a very big conversation and a very complex scenario that we have to look at from very many different angles, because the number of pieces that are moving are so many, and they're all moving at the same time.
Yeah, and I get that, because that's my next question then. What is our short-term and long-term plan? But it's also good to note, Daktari, that in Kenya, we don't lack policies. It's the implementation that is the problem. So if we go this direction, how are we going to make sure that this is actually implemented the way it should to the fullest? Because these are people's lives we're dealing with.
Yeah. Yeah, so those are now, I think that's a very critical observation, because when you look at it, in fact, the three main, we can be able to just collapse all the strategies into three. Number one, we have to cut down on some of the services that we are offering so that we prioritize and make sure that the very critical services remain unimpacted. For example, we are having about 1.4 million Kenyans who are depending on ARVs to keep healthy.
Yeah.
If we now allow that program to be impacted, and it is one of the programs that are likely to be hardest hit by this pullout, if we now let that program to be exposed, we are looking at the possibility of having almost 60,000 new infections by 2030. We are looking at the possibility of losing approximately 23,500 people to TB because of now the increased infections and the impact of HIV.
Yeah.
Out of this 23, maybe 20,000 can be attributed to HIV. So we now prioritize and say we put more emphasis on making sure that this doesn't happen. There are other programs that we might, in the short time, we might say, let us try to put less emphasis on this as we fix this one. But then, as we continue now putting some of the other interventions in place, we pick up now these other programs, which might not be as high priority as the others.
Okay.
Number two, we also have an opportunity to look for other funding sources. It doesn't have to be external. We also have our billionaires here in Kenya. Why can't we also look at improving on philanthropy so that we are having philanthropies plugging in the way they do in the
likes of Bill Gates, yes.
We have them here.
Yeah.
They might not be as rich as Bill Gates, but, you know,
rich enough.
Yeah, they can put in something that will be able to push quite a number of programs.
Yeah.
We have our local, you know, organizations here, businesses and so on, enterprises, which have corporate social responsibility. How can we engage with them, you know, the multinationals that we have here, the big local manufacturers and so on, so that we now be able to change the narrative and say, can we put a little bit more emphasis on healthcare? Because you'll find that most of them are not even in healthcare.
Yeah.
So we can be able to improve on domestic funding. We can also push the needle in terms of allocations. Yeah. Today we were in Parliament. Yesterday we were in Parliament, meeting with the Parliamentary Committee. Parliament appropriates resources. Now this is something, because we look at what we have requested, and we get into a very candid discussion, yeah, about why is it that you are requesting for this money? Have you considered maybe getting it from elsewhere? So we look at the figures that we have presented, and we come down to figures that make more sense. So this is an opportunity for us to be able to say, okay, at this particular moment in time, can we push a little bit so that we get more from Exchequer? Okay. Now, the other thing is that even as we do that, can we also look at integration? Yeah? So that instead of having, say, the HIV program just doing its own programs on HIV, the TB program just doing its own programs, malaria program doing its own. How can we leverage these programs so that while we are conducting some interventions, HIV interventions, we can also carry along TB interventions without spending the expenses that we would have spent if we'd have done it alone, so that we achieve more with the same resources. And then we save and divest that money into something else. Yeah. So there are quite a number of strategies that we can be able to employ to now start plugging the gap. Might not be 100%, but very significant.
And it's good you've talked about the fact that we all need to, you know, come together to ensure that we actually fulfill this. All hands on deck. But also, just the other day, was it on Monday, you had a health summit led by Professor Kithure Kindiki, the Deputy President, as well as CS Health, Deborah Barasa. But also, there are those criticizing that particular summit, saying other stakeholders were excluded. So then does it mean, as we talk about we need to come together on this side, on this end, we're still excluding some stakeholders?
I wouldn't want to look at it that way.
Okay.
Actually, towards the end of the summit, and one of, I saw your colleagues there, very many journalists. One of the recommendations that were made while the Deputy President was now communicating the recommendations and the way forward, was that there are some stakeholders who are missing today. Can we bring them on board? That was something that was observed. So it might not have been, you know, by design. It is just that, you know, as we continue discussing, we start realizing, oh, this stakeholder is not here. This stakeholder is not here. Can we bring them on board? Moving forward, it is going to be very critical that all stakeholders are involved, because everybody has a very important role to play moving forward. It is not business as usual anymore. Actually, for us to be able to get out, to get past this challenge that we are now facing, we will need everybody to identify how they can plug in. I came in a bit early today. I thought that, you know, the communication was that we were coming for the news, and I thought maybe we would do the news together from 9.
Maybe next time.
Yeah?
You can be my co-anchor.
Yes, I was thinking that I would be an anchor. And I was following the conversations, and I saw even the discussions around healthcare. And I could see that there was a lot of splitting of hairs, you know, people are talking and they're agitated and so on. And I said, it is important for us to start looking at things. Let's calm down, let's pause, let's breathe, you know. We all want the same thing. I think we are looking at it in a very, we are looking at it in a very narrow way. Everybody has a role to play. We all want the same thing, but it is a complicated and big task that we want. It's a phenomenal objective that we are pursuing, and sometimes we can get frustrated. So we just need to calm down, speak with each other, engage, have a meeting of minds, look at how can we do this together in the best way.
Okay.
And we will achieve much more. So the whole issue of making sure that all stakeholders, all hands are on deck is extremely important.
Okay, I want us to talk about still on the issues of donor. I mean, HIV, AIDS, malaria, TB, oxygen supply, lab services, cervical cancer, you name it. A number of projects or programs depend on aid. So then what does this mean for a fight against, for example, malaria or TB or HIV, AIDS? Because you said earlier on that we seem to be in panic mode. For our viewers watching you right now, needing reassurance, where are we at?
Let's stop panicking. I think we have already started figuring out what it means. We have already looked at what would happen if we did not act. Yeah? Like, for example, if we did not act, we will lose 12,000 people annually to malaria, If we did not act, we will lose about 23,500 people to tuberculosis, because of the increase in HIV. So we have already been able to identify what are the critical areas that we need to really plug so that we don't have this kind of problem.
Okay.
So there is no need for panic right now. We are really looking at an innovative and smart way of being able to cushion things. But of course, there's a lot of work to be done. If we just sit back and watch, then there will be pandemonium. There will be catastrophe. But if we proceed and we work smart towards achieving whatever we need to do, then we should be able to protect the general populace.
Okay.
Of course, some of us, we have to really work around the clock, just making sure that everything is moving and so on, and engaging and having these discussions, because we cannot do it alone. It is not possible. If we start thinking that as the Ministry of Health, we will pull the whole country out of this, it is not going to be possible.
Yeah.
So we have to start engaging so that everybody can plug in, but we will make it. It is an opportunity, as I said in the beginning, and we believe that we will make it.
All right.
Yeah.
You talked about people coming down, and we'll be talking about it after this short break. But you have to agree that Kenyans are frustrated at
Absolutely.
the moment,
Yeah.
especially when it comes to health matters. And we'll be going on with that. But first, let's take this break.